How would you describe what you're going through?
Well, the disease comes in by many names. It's labeled chronic fatigue syndrome, fibromyalgia, or myalgic encephalomyelitis, all of which are, I think, the same thing. I think it's system-wise debilitation of all the systems in the body, whether it's the neural system, the digestive system, or the muscular system. So it affects all the systems in your body. So that's my definition of this disease.
If there was one word to describe it, what would that word be?
Exhaustion.
You want to elaborate a bit then?
Exhaustion is the primary symptom that I have felt. I might elaborate in the sense and give you a little bit of personal information. I have, in 1984, of the spring, I was a very active person. I had a young family. I worked. I curled, and I came home from a curling bonspiel, and it was about Easter time, and I had the flu. Well, the flu just remained. I had a severe fatigue. The flu just remained for the next 3 years. I was just severely fatigued, could not get out of bed. Was muscle, joint pain, tremendously. And so that's the definition in that period. It was just unrelenting, severe exhaustion. Not fatigue, exhaustion. It's the difference between fatigue and exhaustion. If you can think of yourself as having a severe flu for many years, that's the way you feel each day, regardless of how much rest you have or sleep.
How does it affect your daily life?
How did it affect my daily life? Well, it was very traumatic. Of course, the work, I had to give up my job. I had a young family. I couldn't do housework. I practically had to have somebody look after me for many months. And at that time, they didn't know what it was. They called it mononucleosis. And you couldn't do it. I was very athletic. I couldn't do any of my I couldn't keep up my relationships with people, invite people for dinner. What else?
How did it affect your relationship with your family?
Well, I couldn't do anything with a young child. Take her, for instance, out for Halloween. Mummy was always sick. The young child came home, as all young children come home, with viral, which precipitates our illness. So she couldn't hug. She tells me to this day, she's 32, that you didn't hug me when I was a child because I always had a virus or cold. Family, sort of a very, very hardened on relationships because no one wants to be around an ill person day in and day out. Mother, father, friends saying, oh no, here's that. Is she ever going to get better? Is she a whiner? Is she a malingerer? You know, all I hear from that woman, she's always sick. That sort of attitude.
That must hurt.
How about?
That must hurt you.
Yes, it was very, very distressing to me. And yes, because your friendships went out they were dissolved. Even family members would get how can I say, sick of coming around to, sick is the wrong word.
Tired of coming around.
Coming around or talking to you. And in my part, I couldn't help it. I just couldn't get out of bed. I couldn't, cognitively, you can't read, you can't watch TV, you can't speak. You're in pain. And that time it was frightening, and it's a sense of loneliness and isolation. And it was frightening because it wasn't diagnosed properly. And it wasn't until 1989 that I met a doctor, Dr. Jane, who was treating. And I walked into a waiting room like we have downstairs, and there were several other people talking about the same symptoms that I had. So that's was.
Do you think it's important that people meet?
Definitely, you need a support group, either by telephone, which we've done, or have a physician that understands and can help you. Because family members cannot, they just don't want to hear your problems all the time. You need an objective person to help you out. It's very evident in this illness that we look very well, and but we're very, very ill inside. What you see today, maybe I'll be in bed for the next 2 weeks, or maybe I had been in bed for the next 2 weeks. Now, one of the coping methods I use for this disease is when I'm well enough to get out, I dress up and feel good about myself. And but most of the time it's just, wandering around the bedroom, eating in bed, that sort of thing. It's a very severe illness.
How would you try and spread the word? A lot of people don't understand this disease. So how would you spread the word? If you could spread the word, what are some of your ideas on how to spread it?
Well, we need to have education for physicians, our general and our healthcare workers, and the public. How would I do it? By documentaries like this, by publishing pamphlets. It's an invisible disease. Invisible ailment, disability. People don't see it, so it's hard to understand for people. And it's also hard to understand for people. It fluctuates.